3 o'clock in the morning. The house is quiet, and you wake up with your mouth feeling dry and sticky, almost like cotton. Your tongue feels thick. Your throat may feel scratchy. So you reach for the glass of water beside the bed, take a few sips, and hope that will settle it. But later in the night, you wake up again. Your mouth is dry again. Maybe now you need the bathroom because you drank more water before bed. So you get up, walk through the hallway, half asleep, and try not to turn on too many lights. By morning, you are tired. Your mouth still feels uncomfortable, and you start wondering, why is this happening so often? Many people after 60 brush this off. They say, I'm just thirsty, or I probably didn't drink enough water, or maybe this is just part of getting older. Sometimes thirst or low fluid intake may be part of the story. But here's what many people miss. Dry mouth after 60 is not always just being thirsty, and it is not something to automatically dismiss as normal aging. Dry mouth means your mouth is not staying wet enough. That may sound simple, but saliva does much more than keep your mouth comfortable. It helps you chew. It helps you swallow. It helps you speak clearly. It helps you taste food. It helps protect your teeth and gums. It also helps control harmful germs in the mouth. So when dry mouth keeps coming back, it can affect more than comfort. It can affect eating, sleep, dental health, taste, dentures, swallowing, and even confidence in everyday life. That does not mean you should panic. Occasional dry mouth can happen to anyone, especially after sleeping with the mouth open, feeling nervous, being mildly dehydrated, or spending time in dry air. But dry mouth that happens most of the time wakes you at night, makes food harder to chew or swallow, changes your taste, causes mouth sores, affects dentures, or begins after a medication change is worth paying attention to. This video is for education only. It is not a diagnosis, and it is not a treatment plan. If dry mouth is new, persistent, worsening, or comes with trouble swallowing, mouth sores, infections, tooth problems, dry eyes, swelling around the face or neck, excessive thirst, frequent urination, blurry vision, unexplained weight changes, dizziness, dehydration concerns, medication changes, or symptoms that worry you, talk with a qualified healthcare professional, dentist, or pharmacist. And if you take prescription medicines, over-the-counter medicines, vitamins, herbs, or supplements, do not stop or change them on your own. Before we talk about what to watch for, it helps to understand why saliva matters so much. When your mouth has enough saliva, eating feels natural. Food breaks down more easily. Dry foods are easier to manage. Pills may go down more comfortably. Your tongue moves smoothly. Speech feels normal. Your teeth and gums have a layer of protection. But when saliva is low, everyday things can become irritating. Crackers may feel like sand. Meat may feel harder to chew. Pills may feel like they stick. Dentures may rub. Your tongue may feel dry or grooved. Your throat may feel sore. Your breath may change. Food may taste different. That is why dry mouth is not just a drink more water problem. It is an oral health signal. After 60, dry mouth may become more common, not because aging itself automatically causes it, but because the surrounding factors become more common. Many older adults take several medications. Some have health conditions that affect saliva, hydration, nerves, breathing, or oral health. Some use over-the-counter products without thinking of them as medicine. Some breathe through the mouth at night because of nasal congestion, snoring, or sleep-related habits. Some drink less because they worry about nighttime bathroom trips. Some use alcohol tobacco, caffeine, or mouthwash that may leave the mouth feeling drier. The key is to notice the pattern. Does your mouth feel dry only at night or throughout the day? Is it worse after certain medicines? Did it begin after a new prescription, a new supplement, an allergy pill, a decongestant, a sleep-related product, or a dose change? Does it come with dry eyes? Do you feel unusually thirsty? Are you urinating more often? Is your vision blurry? Are you losing weight without trying? Are you having more cavities, mouth sores, bad breath, or trouble wearing dentures? Those details matter because dry mouth can have more than one possible contributor. Medication is one of the biggest areas to review. Many prescription and over-the-counter medicines can sometimes contribute to dry mouth. This may include medicines used for allergies, congestion, blood pressure, mood, anxiety, pain, bladder symptoms, sleep, and other conditions. That does not mean those medicines are bad. It does not mean dry mouth is always caused by medicine, and it definitely does not mean you should stop taking something on your own. A safer question is, could anything on my medication and supplement list be contributing to dry mouth? That list should include prescriptions, over-the-counter products, vitamins, herbal products, and supplements. Many people forget to mention allergy pills, cold medicines, sleep aids, pain relievers, bladder products, or herbal supplements because they do not think of them as important. But your doctor, dentist, or pharmacist needs the full picture. Timing can be very helpful. If your dry mouth became noticeable after starting a new product, changing a dose, or taking something more often, write that down. If it is worse at a certain time of day, such as after evening medicines or during the night, mention that too. Another common clue is mouth breathing. If you wake up with a very dry mouth, especially if your nose is stuffy, you snore, or you sleep with your mouth open, the dryness may be worse overnight. That does not mean mouth breathing is the whole cause, but it is a useful clue. Nighttime dry mouth can also lead people to drink more water before bed or during the night. That may increase bathroom trips, and if those bathroom trips happen while you are half asleep, in the dark, or feeling unsteady, that becomes a separate safety issue worth noticing. This is where a small symptom can quietly affect independence. Dry mouth may disturb your sleep. Drinking more at night may increase bathroom trips. More bathroom trips may mean more walking in the dark, and walking in the dark while half asleep can become a balance risk moment, especially if there are loose rugs, poor lighting, slippers that do not fit well, or a wet bathroom floor. The point is not to be afraid. The point is to see how one repeated symptom can affect several parts of daily life. Hydration can also be part of the picture, but it should be handled carefully. Some people simply do not drink enough during the day. Others intentionally limit fluids because of bladder urgency, nighttime urination, or fear of accidents. That is understandable. But not everyone should be told to just drink more water. People with heart, kidney, or fluid restriction concerns may need personal guidance. The safer approach is to ask your healthcare professional what amount of fluid is appropriate for you and whether your dry mouth seems related to hydration, medications, breathing, blood sugar, or something else. Caffeine, alcohol, and tobacco can also make dry mouth worse for some people. Alcohol can dry the mouth and affect sleep. Tobacco can irritate the mouth and change oral health. Caffeine may be part of the pattern for some people, especially if it affects hydration habits, sleep, or urination. This is not about judgment. It is about noticing whether your dry mouth is worse after certain drinks habits, or routines. Mouthwash is another detail many people overlook. Some mouthwashes contain alcohol, and for some people, that may leave the mouth feeling drier or more irritated. If you use mouthwash and your mouth burns, feels tight, or feels drier afterward, mention that to a dentist. Do not assume every product that feels strong is right for a dry mouth. Food choices can matter too. Spicy, salty, acidic, sugary, or very dry foods may bother a dry mouth. Crackers, chips, toast, dry meat, or dry cereal may be harder to chew and swallow when saliva is low. Some people begin avoiding certain foods because they are difficult to manage, and without realizing it, their meals become softer, smaller, or less balanced. That is why dry mouth can become a nutrition clue. If eating becomes harder, you may eat less protein, fewer vegetables, fewer fruits, or fewer fiber-rich foods. You may avoid foods that require chewing. You may skip meals because your mouth is uncomfortable. Over time, that can affect energy, weight, strength, and daily confidence. Dental health is a major part of this topic. Saliva helps protect teeth and gums. When the mouth is dry most of the time, the risk of tooth decay, gum problems, bad breath, irritation, and mouth infections may increase. Dentures may also become harder to wear comfortably if you notice new cavities, sore spots, a burning feeling, cracked lips, mouth sores, gum problems, or denture pain. Bring that up with a dentist. Dry mouth is not only a comfort issue, it can change the health of the whole mouth. Dry mouth can also appear along with dry eyes, and that combination is worth mentioning. Sometimes dry mouth and dry eyes may be related to medications, environment, dehydration, or other factors. In some cases, a clinician may consider conditions that affect moisture-producing glands. That does not mean dry mouth plus dry eyes gives you a diagnosis. It simply means the pattern is worth discussing, especially if it comes with fatigue, joint pain, dry cough, swelling around the face or neck, numbness, weakness, or other symptoms. Blood sugar clues also matter. Dry mouth by itself does not mean diabetes, but dry mouth with excessive thirst, frequent urination, blurry vision, extreme fatigue, slow healing cuts or bruises, unexplained weight changes, or tingling in the hands or feet is a pattern worth discussing with a healthcare professional. Again, the point is not to diagnose yourself. The point is to notice when dry mouth is part of a larger body signal. Your medical history matters too. If you have had radiation or chemotherapy involving the head or neck, or a history of cancer treatment affecting that area, dry mouth should be discussed with your care team or dentist. If you have nerve injury, autoimmune symptoms, Parkinson's disease, Alzheimer's disease, or other chronic conditions, those details may also belong in the conversation. You do not need to figure out the cause alone. You need to bring the right clues to the right professional. One common mistake is treating dry mouth as harmless just because it is common. Dry mouth may seem small compared with chest pain, dizziness, or swelling, but if it affects eating, sleep, swallowing, teeth, gums, taste, or comfort, it is not trivial. Another mistake is trying to manage it by constantly sipping sugary drinks or sucking on sugary candy. That may feel soothing for a few minutes, but it may create other concerns for teeth and blood sugar. If you need something for dry mouth, ask your dentist or pharmacist what products are appropriate for you, especially if you have diabetes, swallowing problems, dental issues, or medication concerns. A third mistake is changing medicines without guidance. Some people notice dry mouth after a new medicine and decide to skip doses or stop the medicine. That can be risky. A safer approach is to say, this symptom started after this change. Could we review my options? Sometimes a professional may adjust a plan, but that decision should be made with proper guidance. The key is to notice the pattern clearly. Start with timing. When did the dry mouth begin? Is it new, or has it slowly built over months? Is it worse in the morning, at night, after meals, after certain medicines, after caffeine or alcohol, or during stress? Does it happen every day, or only occasionally? Then notice what it affects. Is chewing harder? Do you need water to swallow food? Do pills feel like they stick? Is talking uncomfortable? Has your taste changed? Are you avoiding certain foods? Are dentures rubbing or slipping? Are you waking up often to drink water? Then look for related symptoms. Dry eyes, mouth sores, burning mouth, bad breath, tooth decay, gum problems, hoarseness, dry throat, frequent thirst, frequent urination, blurry vision, weight changes, fatigue, dizziness, swelling around the face or neck. These clues help your healthcare professional understand whether dry mouth is isolated or part of a larger pattern. A simple note can make an appointment much more useful. You might write, dry mouth started 3 weeks ago after a new allergy medicine, or I wake up every night with a sticky mouth and need water to swallow, or food tastes bland and I am eating less, or my mouth is dry, my eyes feel gritty, and I am more tired than usual, or I am drinking more and urinating more often. Those details are much more useful than simply saying, my mouth feels dry sometimes. When you speak with your doctor, dentist, or pharmacist, ask practical questions. Could any of my medicines, over-the-counter products, vitamins, herbs, or supplements be contributing? Could mouth breathing, snoring, alcohol, caffeine, tobacco, or mouthwash be making it worse? Should my teeth, gums, dentures, or mouth be checked? Is the dry mouth affecting my ability to chew, swallow, taste, eat, or take pills? Do my dry eyes, fatigue, thirst, urination changes, or weight changes suggest anything that should be evaluated? What dry mouth products are safe for me? These are calm, useful questions. They do not assume a diagnosis. They help you get better guidance. There are warning signs that should not be ignored. Dry mouth that does not go away, dry mouth that is new or getting worse, trouble chewing or swallowing, mouth sores, cracked lips, recurrent mouth infections, new tooth decay, gum problems, bad breath that does not improve, denture pain, or a burning mouth feeling should be discussed with a dentist or healthcare professional. Dry mouth with dry eyes, gritty eyes, joint pain, fatigue, dry cough or swelling around the face or neck is also worth mentioning. Dry mouth with excessive thirst, frequent urination, blurry vision, unexplained weight change, slow healing cuts, or tingling in the hands or feet should be discussed with a healthcare professional. Dry mouth with dizziness, weakness, dark urine, vomiting, diarrhea, or inability to drink enough fluids may raise dehydration concerns and should not be ignored. And if dry mouth begins after a new medication, a dose change, or a new supplement, do not guess. Ask your doctor or pharmacist. The purpose of this message is not fear, it is awareness. Dry mouth after 60 may be simple. It may be related to sleep, mouth breathing, mild dehydration, or a product you use. But if it keeps coming back, affects your eating or sleep, changes your dental health, or appears with other symptoms, the pattern is worth checking. This video is for education only and should not replace medical care. If dry mouth is new, persistent, worsening, or comes with trouble swallowing, mouth sores, infections, tooth problems, dry eyes, gland swelling, excessive thirst, frequent urination, blurry vision, unexplained weight change, dizziness, dehydration concerns, medication changes, or symptoms that worry you. Talk with a qualified healthcare professional, dentist, or pharmacist. Do not stop or change medications or supplements on your own. Dry mouth is not always just thirst, and it is not automatically part of aging. When you notice the pattern, protect your mouth and ask better questions. You are not just dealing with discomfort, you are protecting your eating, your sleep, your dental health, and your independence after 60.